All right, well, thank you everyone for being here today. I'm Representative Sarah Roberts from the 18th District, and joining me here today are two other bill sponsors, Representative Hovey-Wright and Representative Driscoll will be joining us very shortly, and there she is. And very happy to see Representative Cochran, Representative Zemke, and Representative Hoadley here in support with us today. I'd also like to introduce Dr. Lauren McAfee, an OBGYN from the University of Michigan Health System. As you may recall, in 2013, a law was passed restricting women's access to necessary medical care. This was a citizens' initiative where petition signatures were collected and delivered to the legislature, and the legislature decided to take action on that initiative. And this law prohibits private insurance companies from covering abortions unless the life of the mother is at risk. There's some gray area in terms of miscarriages. And then coverage for abortion would be provided if the woman went out and purchased a separate insurance rider to cover the procedure. Now, women who face serious health risks during pregnancy or a serious genetic abnormality or who become pregnant following rape are now told that they must think ahead and buy insurance in case they ever have to face one of these tragic situations. And we've been fighting to repeal this dangerous law, and completely repealing this law is our ultimate goal. However, until that goal is reached, because it's no surprise, we've had no committee hearing, we've had no vote on this, we need to do what we can right now to make this law less harmful to Michigan women. Now, back in 2014 and 15, I proudly introduced a bill to completely repeal the abortion rider law. And in 2014 and 15, I think all of us proudly supported Representative Pam Ferris's bill that would require the health insurance companies to provide the additional rider policy. Because as of right now, just 8 of the 42 insurance companies offer the rider. So meaning there are women who may want to purchase this rider and they don't even have access to it. They can't even get the coverage if they're trying to think ahead that something horrible and tragic may happen to them during their pregnancy. So the legislation we're unveiling today would exempt women in the most dire and tragic circumstances. This includes abortions needed to preserve the health of a woman, to end a pregnancy where there's a severe genetic abnormality, or when a woman becomes pregnant as a result of rape or incest. Women in these situations deserve compassion. Instead, they are being told that they should have thought ahead and prepared for these extreme and tragic events. So my bill specifically would protect women when there's a problem with a genetic abnormality. It would provide insurance coverage for the medical needs of that woman if, in the physician's reasonable medical judgment, such an abnormality necessitates the termination of a pregnancy. Often, these pregnancies can't be carried to full term. It's a heartbreaking experience, and one that no woman ever wants to contemplate, let alone go through. And when a procedure is done to end such a pregnancy, however, it's usually referred to as an inevitable abortion. And because it has the word abortion, insurance companies won't cover the procedure for fear of violating the abortion rider law. That can cost a woman and her family up to $10,000. It's bad enough that a woman who desired to become pregnant and to have a child and has yearned for that then has to deal with a very tragic loss. And it's even worse when a woman and her family are faced with thousands of dollars in medical bills, even when they have insurance that likely covers most of their other medical needs. These women and their families deserve compassion and support, not cruelty, and a necessary medical procedure determined by insurance rather than sound medical judgment. And next, I'd like to introduce Representative Hovey-Wright to talk about her bill.
Thank you, Representative Roberts. I am Representative Marcia Hovey-Wright from the 92nd District, which includes Muskegon Heights, and some other townships to the north. Everyone who has a child knows that pregnancy is demanding on a woman's body. And if we're lucky, we make it through the 9 months of pregnancy without any events. Sadly, that's not the case for every woman. For instance, 1 in 3,000 women also develops breast cancer during pregnancy. In other cases, complications from gestational diabetes, high blood pressure, or other medical conditions might lead a physician to recommend terminating a pregnancy to preserve her health. When a doctor tells a woman that she needs to end a pregnancy to preserve her health and possibly her ability to have children in the future, she should not be punished for taking that advice. The fear and grief of a woman in this situation must be overwhelming, I can't imagine. That's why the state has no business making it harder for a woman to make necessary steps to preserve her health at such a vulnerable moment. When it comes to serious medical situations, decisions should be based on what is the most likely result in a good outcome, not on the law that was passed to please special interests or dictated by insurance coverage. When a woman needs to end a pregnancy to save her health, she should be exempt from this abortion right or law. It is the compassionate thing to do, and it's the right thing to do. That's why we're going to fight hard to see this bill and other bills introduced today signed into law. Now I'd like to introduce Representative Gretchen Driskell, who will tell us about her bill.
Thank you, Representative Hovey-Wright. I'm Gretchen Driskell, and I represent House District 52, which is in Western Washington County. And I'm really grateful for the opportunity to tell you about my bill, which would ensure that when a woman becomes pregnant following rape or incest, she won't be financially punished for it. As all of you may know, sexual assault is one of the worst experiences a woman can go through in their life, and it's a life-changing event. And according to the American Journal of Obstetrics and Gynecology, about 5% of the women between the ages of 12 to 45 become pregnant after a rape. So 5% of women between the ages of 12 to 45. In the U.S., that's 32,000 pregnancies a year resulting from rape. A survivor of rape and incest does not deserves justice and deserves compassion. As we talked about before, the law that's been put in place that requires the writer is really unreasonable, and she deserves a chance to recover. This would be complicated by forcing her to give birth to the rapist baby if she couldn't afford the medical care on her own. She doesn't deserve a state law, which we have in place currently, that tells her that she should have thought ahead, that she should have bought extra insurance, not even knowing that she would be experiencing the tragedy that she experienced. Making sure that these women don't fall under this onerous abortion rider is the very least that we can do for them. That's why I'm going to fight for seeing this bill and all the other bills that are outlined here today signed into law. And now I'd like to introduce Dr. Lauren McAfee from the University of Michigan OBGYN department. Thanks.
Thank you, and good afternoon, everyone. I'm an obstetrician gynecologist from Ann Arbor, here to speak in support of the 3 bills being introduced today. As a woman's health provider offering comprehensive reproductive health care, including abortion, I recognize the importance of insurance coverage for all reproductive health services and see the barriers that women face to access such services on a daily basis. These bills will help women facing already difficult situations make the decision that is best for them and their families without being coerced by additional financial barriers and stigma. As a physician, I highly value the intimate relationships that I'm able to develop with my patients, and am greatly troubled by legislative interference into medicine. For far too long, politicians have interfered in women's health decisions by banning insurance coverage for abortion care. Every patient is unique, every situation different. No one plans to need an abortion. However, 3 in 10 women will have an abortion by the time they are 45 years old. To give some perspective on the impact this legislation could have, I'd like to share a few patient stories. The first woman, who I'll call Kate, is a married mother of 2. She came for her 20-week appointment to find out the sex of the baby, only to find out that her fetus was affected by a condition known as anencephaly, where parts of the brain, skull, and scap are missing. This is known to be almost uniformly incompatible with life, and Kate and her family were devastated by this. She was informed that most fetuses with this condition will either die in utero or die within a few hours or minutes of birth. She was counseled about the options of continuing her pregnancy versus undergoing an abortion and ending the pregnancy. In consultation with her family and her doctors, she made the difficult decision to terminate the pregnancy. Unfortunately, however, her insurance coverage didn't include abortion services. And because Kate and her family didn't have the financial means to pay out of pocket for an abortion, she was forced to continue her pregnancy. The baby died shortly after birth, and Kate had to explain to her two small children why their sibling wasn't coming home and help them to process and understand, all while grieving herself. This should have been Kate's decision, not up to the legislators, not up to the insurance providers. It should have been up to Kate, her family, and her doctors. This bill would enable women like Kate to pick the treatment best for herself and her family without the influence of insurance or financial burdens to sway their decision. Another patient comes to mind who I'll call Jasmine. Jasmine has chronic kidney disease and requires dialysis treatments 3 afternoons per week. This is all while working full-time and caring for her 2-year-old son, who happens to have been born at 5 months, 26 weeks of gestation, very premature, and as a result has many medical and developmental needs. Jasmine was on the list for a kidney transplant when she found out she was unexpectedly pregnant. As a result, she was put on hold for a transplant because women who are pregnant are ineligible to have a kidney transplant or transplant of any kind. And she was informed that during her pregnancy, her kidney disease could worsen. She would need to increase her dialysis to 6 afternoons per week, and she was at risk for another preterm birth and for having a very small infant. After a lot of discussion with her family and medical providers, she felt that an abortion was the best decision to allow her to continue on to be a mother for her son and to improve her health and keep her health safe. Her insurance company denied her request for abortion coverage despite her medical conditions. With the financial support from friends and working overtime, Jasmine was able to have an abortion and continue on with her life, but not without the stress of such a difficult decision, confounded by the financial burden caused by the lack of insurance coverage. Jasmine's care should have been covered. At the end of the day, we need to trust that women will make the decision that is right for themselves and their family. We need to be aware of the harmful consequences that can occur with policies and legislation that limit a woman's access to health care. And we need to ensure that every woman has access to comprehensive reproductive health care, including abortion, regardless of the type of insurance that she has. We need to even the playing field so that women in Michigan can continue to lead healthy and productive lives. We're not there yet, but these bills are definitely a step in the right direction. To wrap up, I'd like to bring back Representative Roberts. Thank you.
Thank you. Thank you, Dr. McAfee. I think, you speaking here today and sharing the stories that you did, this is real life. This is happening to real women. And when Right to Life went out and gathered a small percentage of the population signature to go after abortion, in their haste, they have forgotten about or did not think about some of the complications that happen during a pregnancy. And it is hurting women. It is hurting women and their families here in Michigan, and it is wrong. These bills are not political. They are the right thing to do. They make sense. They're based in actual medical complications or tragedies that happen in real life to real women. So, again, to restate, women who face serious health risks, significant genetic abnormalities, or when women who have become pregnant after rape or incest deserve exemptions to this harmful law.